Welcome to the deep dive. Today, we're really getting into something significant. We're looking at Chapter 4 of Bessel van der Kolk's, well, seminal work, The Body Keeps the Score.
It's a chapter that really lays the groundwork, doesn't it, for understanding the core message.
It really does. You've brought us these key excerpts, and our mission really is to unpack them. We want to explore how trauma fundamentally reshapes, the brain, the mind, the actual physical body.
And not just the big, obvious events, but how it filters down into everyday experience, the subtle stuff.
Exactly. We'll look at the history, the struggle to even recognize this, and how these internal shifts play out. Get ready for some powerful stories and maybe a new way of seeing things.
Let's dive in. The chapter starts with the author's early experiences, this time when trauma was, it was largely a mystery.
Right, and he opens with Tom. That story is just so vivid.
Tom, the Vietnam vet, 10 years on, and the war is absolutely still present for him. You get this immediate sense of isolation, avoiding his family on a holiday weekend.
Hiding out in his law office. Because as the source says, everyday things, fireworks, the heat, even backyard foliage, they just pull him right back.
Yeah, back to the jungle, back to combat.
Yeah.
And the tension at home. His kids' noise making him agitated.
And that fear he describes, that deep fear of losing control, of hurting his family, feeling like a monster inside.
It's heartbreaking. And then needing these extreme measures, the heavy drinking, riding his Harley super fast, just to feel okay for a moment, just to quiet the internal storm.
It paints such a stark picture. And then the author connects it, doesn't he, to his own family history.
Wondering about his father, his uncle, both veterans too. Did they carry similar burdens? The nightmares, the distance.
And that really unsettling detail about his mother fainting when asked about her childhood.
And blaming him for it afterwards. Wow. It's like an early personal glimpse into how trauma gets silenced, hidden, pushed away.
You can see how that personal connection would fuel his professional interest. But then he looks for answers.
And finds almost nothing. Not in his psychiatric training, not in the big libraries at the VA or Harvard. It's kind of shocking.
He mentions finding only one book, right? Abram Gardner's from 1941.
Yeah, about World War I veterans. And apparently it was only published because World War II was starting. Think about that.
5 years after the end of the Vietnam War, and the medical world was basically silent on combat trauma. It wasn't really a thing.
And the source suggests this silence isn't accidental. It reflects a wider societal reluctance, to really face these hard truths.
We don't really want to know, as he puts it, about soldiers, about child abuse, domestic violence.
It's easier to believe families are safe havens, our country is civilized, but that denial, it makes it tough for people looking in and almost impossible for the person living with the trauma to bear it without needing to numb out somehow.
So this lack of understanding meant the early approaches at the VA were pretty ineffective.
Deeply frustrating, it sounds like. They're just trying to fit veterans into existing boxes. Alcoholism, depression, sometimes even schizophrenia.
And the treatments for those conditions.
They just didn't work. Powerful drugs often just left them feeling foggy, disconnected. And talk therapy, counterintuitively.
Could actually make things worse, triggering flashbacks.
Exactly, which led to high dropout rates. I mean, why stick with something that makes you relive the absolute worst experiences of your life?
It really underscores the limits of the standard medical model back then.
He describes morning rounds, focusing only on managing the immediate crisis, suicidal thoughts, self-harm, but very little digging into the why.
The causes of the suffering weren't really the focus.
No, and little attention paid to the rest of their lives, their strengths, hopes, relationships, what he calls the ecology of their lives. That whole picture was missing.
That phrase, ecology of their lives, I like that. It captures seeing the whole person. And his moonlighting story at the Catholic hospital really drives this home.
Oh, yeah. Doing physicals on women about to get electroshock therapy.
Yeah.
And he starts just asking about their lives.
There are difficult marriages, problems with kids, guilt.
And just being listened to, really heard, had this visible effect. They'd brighten up, unburden themselves. Some even started wondering if they still needed the ECT.
But he knew the treatments would go ahead anyway, that sadness. It shows how powerful just listening can be, but the system wasn't set up for it.
Which leads us to Sylvia's story. Incredibly impactful.
19. Described as beautiful, but terrified, mostly mute, refusing to eat.
And the decision was made to force feed her. The description is brutal. 3 people holding her down, the tube.
And then later she confesses the childhood sexual abuse. by her brother and uncle.
And the gut punch for the author, realizing that the force feeding, meant as medical care, felt like a gang rape to her. It replicated the trauma.
It wasn't just a procedure, it was a re-traumatization.
That led to his core rule for students, which feels so obvious now, but was revolutionary then.
If you do something to a patient that you wouldn't do to your friends or children, consider if you're unwittingly replicating a past trauma.
It forces that shift, doesn't it? To consider the patient's subjective experience, their history. It came right out of that visceral, awful encounter.
And that's the pivot point, really, moving from trauma as just mental or behavioral to understanding its deep roots in the body and brain.
Exactly. The source states it plainly. All trauma is preverbal. It happens faster than thought, faster than words.
The Macbeth quote nails it. Tongue nor heart cannot conceive nor name thee. Speechless terror.
You see it in the automatic responses, screaming yes, but also total shutdown, freezing, kids literally losing language, soldiers with those vacant hollow eyes, the body's reacting before the conscious mind catches up.
Because the brain's #1 job is survival. It's organized to survive.
Right. When danger hits, the alarm system fires up these pre-programmed physical escape plans in the oldest brain regions.
The reptilian brain, the lizard brain.
That takes charge. It partially shuts down the higher thinking brain and just compels the body. Run, hide, fight, or freeze. Movement, or lack of it, happens before full awareness.
If it works, things reset. But with trauma,
It gets stuck. The system doesn't reset properly, which is why understanding the brain's structure from bottom to top is key.
this hierarchy, the emotional brain at the core,
Reptilian brain plus the limbic system. It's constantly scanning for danger or maybe opportunity, signaling with hormones, creating those gut feelings, the racing heart.
those visceral sensations aren't just side effects, they're the signals redirecting us.
Influencing tiny decisions and huge life choices.
Mhm.
And the thalamus is like the central relay station.
The cook, the source calls it, trying to blend all the incoming sensory data sites, sounds, smells into one coherent story. Okay, this is what's happening.
But there are two routes for that information.
The fast track and the scenic route, the low road and the high road.
Exactly. The low road zips straight to the amygdala, the brain's smoke detector, the fear center. Bypasses conscious thought entirely.
While the high road goes up to the frontal lobes for slower, more considered processing.
But when the threat is overwhelming, that processing system breaks down. The thalamus gets overwhelmed. Sensations don't get integrated. They become fragmented, dissociated. Memory falls apart. Time gets weirdly distorted, stretched out, or frozen. The whole system gets hijacked.
And mirror neurons play a role here too, right? In connection, but also vulnerability.
Yeah, mirror neurons are that sort of neural Wi-Fi. They help us empathize, imitate, feel in sync with others. We pick up their movements, emotions, intentions, often unconsciously.
Which is great for connection, but
It makes us vulnerable to absorbing negativity, too. And the source links this directly to trauma, saying trauma often involves a fundamental lack of being seen, of being attuned to, of being mirrored safely. Part of healing is about reactivating that safe mirroring.
so when this whole system gets stuck on high alert, you get triggered responses.
Even tiny cues, a bump in the road, a kid running into the street for a vet, a certain smell or image for an abuse survivor can set off the entire alarm system as if the original danger is happening right now.
Leading to hypervigilance, startling easily, rage, or the opposite, total numbing.
And even if someone looks calm on the outside, inside their body is often in overdrive heart racing, stress hormones flooding the system.
The smoke detector goes on overdrive analogy is so good here.
It really captures it. Stan's brain scan during a flashback shows it perfectly. The amygdala, the smoke detector, is lit up like a Christmas tree. But the left brain, the part that makes sense of things, uses language. It's blank, gone offline.
So the brain isn't distinguishing past danger from present reality.
Not at all. It triggers the full physiological panic response, sweating, trembling, blood pressure spikes, all appropriate for a real threat, but happening right there in the scanner, completely disconnected from the current safe environment.
And then there's the other side of the coin when fight or flight aren't possible.
Into mobilization.
The shutdown, the dorsal vagal complex, or DVC, takes over. This happens when you're trapped, helpless, maybe too small to fight or flee.
The body basically surrenders. Biologically, yes. Heart rate plummets, breathing gets shallow. You feel zombie-like, disconnected from yourself, your surroundings. Dissociation, fainting, collapse. The source argues this state is at the root of most severe, complex traumas.
And depersonalization is a common experience in this state.
Yeah, the author saw it often. Patients telling horrific stories with absolutely zero emotion. Just flat. The energy just drains from the room.
The therapist has to work hard just to stay present.
Right. And seeing Ute brain scan, where almost her entire brain just tuned out, that was a turning point. It showed him talk therapy is basically useless when someone is in that state.
Their brain literally can't process it, can't think clearly, feel deeply, remember properly, make sense of it.
It's not just psychological, it's profoundly physiological, a different neurological state.
And when someone is living predominantly in these states, either hyper-aroused or shut down, it profoundly changes their daily experience.
Which brings us to that lived reality of trauma, the numbing, the disconnection, and the often destructive ways people learn to just survive.
Let's talk more about that numbing. We saw it with Tom.
That feeling of a frozen heart, living behind glass, feeling distant, even from his own family, hardly recognizing himself, observing his life from the outside.
Floating in space, lacking purpose, it's a profound lack of connection to self.
And the Rorschach findings mentioned earlier reinforce this. Traumatized people either see the trauma reflected everywhere in the ink blots, or they see nothing, just blankness.
There's a loss of that capacity for imagination, for mental playfulness.
Yeah, either trapped replaying the old horror reel, or just empty, no flexibility.
And this numbness, this difficulty being present, it connects to the struggle to feel genuinely alive now.
That's such a crucial point in the source. The real challenge isn't just dealing with the past trauma, but actually improving the quality of your moment-to-moment experience right now.
Because if you can't feel fully alive in the present,
your mind drifts back to times when you did feel intensely, even if those feelings were awful, terror, misery, because at least it was something. Traumatic memories dominate partly because the present feels so empty or unsafe.
Which casts doubt on approaches focused only on desensitization, right?
Exactly. The source is critical of just trying to numb the reaction to past triggers. Re-exposure can easily backfire, triggering flashbacks. And even if it works to reduce reactivity,
it doesn't necessarily help you feel joy or satisfaction in ordinary life. Taking a walk, cooking dinner, playing.
The goal needs to be bigger. Helping people feel safe and fully here, now. Bringing those offline brain systems back online so they can actually experience the present.
And a huge part of being present is sensing your own body, which the source says is often difficult for trauma survivors.
They really struggle with interoception sensing internal states. He uses a simple example of holding an object, feeling its shape, weight, texture, integrating all that into, this is a cup. But McFarland's research showed PTSD patients often struggle to put that sensory picture together.
It reminds me of that William James case, the woman with sensory insensibility.
Oh, that description is chilling. Feeling like she had no human sensations, totally separated from her body, a void inside, unable to really connect with things she touched.
Resulting in an impossibility of any enjoyment, which she called incomprehensible torture.
It shows just how fundamental sensory experience is to feeling alive. When the senses are muffled, life loses its color, its texture, its pleasure.
And this difficulty sensing the body is tied to alexithymia.
Right. Difficulty identifying and describing emotions. You ask, how would you feel if a truck was coming at you? And they say, I'd move, instead of I'd be terrified.
They might experience emotions as physical symptoms. Instead, mystery aches, stomach problems with no medical explanation.
Yeah, and research shows they struggle to read emotions in other people's faces, too. It's a disconnect from the whole emotional world, inside and out.
And this bodily disconnect has real-world consequences for behavior.
If you can't sense the subtle shifts in your body, you lack nuanced responses. You might go from 0 to 100 totally spaced out, or explosive rage, often without knowing what set you off.
The source links it to poor self-protection, higher rates of being re-victimized.
And difficulty feeling pleasure, sensuality, finding meaning. It's pervasive.
Which brings us to that really powerful concept. When problems are really solutions, based on Vincent Felidi's ACE study work.
Yes, Felidi's story about the woman whose extreme obesity, a clear health problem, was actually her solution to cope with underlying trauma.
And when she lost the weight after surgery, removing that coping mechanism?
She became acutely suicidal, needed multiple hospitalizations, ECT. It's a stark warning. If you mistake a survival strategy for the core problem and just remove it, without addressing the trauma underneath or offering alternatives, things can get much, much worse. Addiction is another common example.
Or think about the kids mentioned, Anthony and Maria, with their long lists of diagnoses.
Anthony with ODD, ADHD, RAD, PTSD, depression. Maria labeled aggressive, impulsive, mute. The source argues these labels often obscure the real issue. Their behaviors are trauma responses, desperate attempts to manage overwhelming fear, distrust, and internal chaos.
But the system often focuses on the behaviors, not the trauma etiology.
Right, and the memory of helplessness itself gets stored physically, in muscle tension, bracing, or sense of certain body parts feeling dead or disintegrated.
The parts involved in the trauma head back for accidents, pelvic area for abuse.
Lives can become organized around avoiding or numbing these uncomfortable internal sensations, leading to things like
Serial obesity, anorexia, addictions to work or exercise, and substance abuse. The source says half of traumatized people turn to drugs or alcohol.
desperate attempts at self-medication. And the flip side can be intense sensation-seeking, cutting, risky behaviors, gambling.
Trying to feel something to break through the numbness, even if it's dangerous. Like Sherry's skin picking it brought relief, made her feel alive, but was misinterpreted as suicidal behavior.
These aren't character defects, they're survival adaptations. Often brilliant, in a way, but ultimately costly.
Okay, this seems like a good moment to just pause briefly. If you're finding this deep dive valuable, if it's resonating with you, please do consider hitting the like button or subscribing to the channel. It really helps others find this content.
Yeah, it makes a difference. And understanding these survival strategies, knowing they come from somewhere, is so important. Which leads us naturally into how these patterns get set up in the first place, the roots in early life.
The source is emphatic. We get our first lessons in self-care from the way that we are cared for. Our ability to manage ourselves emotionally, our self-regulation, it's built right there in those first interactions.
Reliable, attuned parents give you a kind of lifetime advantage.
A buffer. This is John Bowlby's attachment theory, right?
Exactly. Bowlby saw that babies are hardwired to connect, to seek closeness. They're incredibly sensitive to caregivers' cues, facial expression, tone of voice, posture, even subtle physiological shifts. It's biological, essential for survival.
And responsive caregiving leads to secure attachment.
Which fosters healthy ways of relating later on. It's all about that dance of attunement.
That feeling of being met, understood, on a really subtle, often nonverbal level, like infants hearing the musicality in their mother's voice even before birth.
And when that dance goes well, you see secure attachment. Think of the strange situation experiments.
The securely attached baby explores, gets upset when mom leaves, but is easily comforted on her return and gets back to playing.
Contrast that with insecure attachment, often from caregivers who are unresponsive or rejecting. These kids cope differently. Some become really anxious and demanding.
Others become passive, withdrawn. And crucially, contact with the caregiver doesn't really soothe them. They don't settle back into play easily.
Then there's disorganized attachment. This is often linked to frightening or abusive parenting.
But also, parents who are overwhelmed by their own unresolved trauma, maybe domestic violence, past abuse, major loss, they can be unpredictable, scary, emotionally unavailable.
And often, the source notes these caregivers are completely unaware they're out of tune with their child. Like Beatrice Beebe's video study. The mom misses the baby's signal for a break and pushes harder, which feels intrusive and overwhelming to the infant.
The long-term impact of this kind of caregiving is huge.
If your needs are ignored or you feel resented, you learn to expect rejection. You might cope by shutting down, pretending it doesn't matter, but inside, the body stays wired for danger, braced for the next blow or abandonment. That's dissociation, knowing and not knowing at the same time.
And this sets the stage for serious difficulties later on.
Chronic problems with managing emotions, controlling impulses, attention, thinking, dissociation, and especially relationships. They might overreact to peers, misread social cues, shut down, lash out, get rejected, develop a tough facade, or retreat inward.
And the trauma gets passed down. That 9/11 study is striking.
Claude Chemtab's work. Kids of moms with PTSD or depression after 9/11 were significantly more likely to have emotional and behavioral problems, especially aggression. The dad's PTSD seemed to affect the kids, mainly by impacting the mom. It really shows how much traumatized parents need support to be attuned.
Even animal studies show this biological link between early care and later stress response.
Yeah, the rat pups whose moms lick and groom them more, handle stress better, have better brain development in key areas like the hippocampus. Rhesus monkeys show similar patterns.
And the source mentions human studies too, epigenetics. How experiences like abuse or even major stressors like that Quebec ice storm can actually change how our genes are expressed.
It's mind-blowing. The social world literally talking to our biology, changing how our hard wiring functions. It's not just chemicals, it's experience shaping us at a fundamental level.
But the source also highlights the positive side of secure attachment.
Yes. When kids feel safe and seen, They learn to communicate their whole selves, frustration, distress, but also joy, interests, preferences. That attuned parental response acts as a buffer, preventing experiences from becoming overwhelming and traumatic. It builds resilience from the ground up.
So understanding this deep impact on brain, body, and development inevitably led to questioning how we diagnose and treat trauma and the wider societal implications.
Absolutely. The power and the limitations of diagnosis become really clear. Before PTSD was officially recognized for Vietnam vets in the 70s,
It was impossible to systematically study treatments. There was no shared language, no framework.
but getting PTSD into the diagnostic manual, the DSM-3 in 1980, was a game changer. It legitimized the suffering, fueled research, and led to effective therapies, first for vets, then for survivors of assault, accidents, disasters. Funding increased dramatically.
Yet, even with PTSD as a diagnosis, the system struggles with complex trauma, especially in kids.
Right. As professionals started treating more kids through networks like the NCTSN, they saw that standard diagnoses just didn't fit the reality of chronic interpersonal trauma, ongoing abuse, neglect, witnessing violence, disrupted caregiving.
These kids often end up with multiple diagnoses, 3 to 8, the source says.
Right.
ADHD, ODD, anxiety, depression.
It becomes this confusing alphabet soup that obscures the root cause, the trauma. And it leads to fragmented treatment, chasing symptoms instead of addressing the core injury and its impact on development.
Which is why the developmental trauma disorder, or DTD, diagnosis was proposed.
To capture that specific reality, the proposed criteria emphasize exposure to multiple, prolonged, severe interpersonal traumas starting early in life, plus significant disruptions in caregiving. It's about that toxic combination.
And the ACE study brought the sheer scale of this exposure into the mainstream consciousness.
Felidi's Adverse Childhood Experiences study was landmark, especially because the participants were mostly middle-class, educated, insured people, not some other group.
And the numbers were staggering. Only a third reported no ACEs.
1 in 10 experienced frequent emotional abuse. Over a quarter, physical abuse bad enough to leave marks. Nearly 30% of women and 16% of men, sexual abuse. 1 in 8 saw their mother being abused. These are common experiences, hidden in plain sight.
And they rarely happen in isolation. They cluster.
Exactly. And high ACE scores correlate strongly with problems later in life, workplace issues, financial struggles, lower income. The impact ripples out. And it takes a toll on physical health, too. Obesity, lung disease, autoimmune disorders. Chronic stress wears the body down.
Bringing us back one more time to problems as solutions.
ACEs drastically increase the likelihood of developing these coping mechanisms, the obesity, the addictions, the acting out behaviors. There are attempts to survive an unbearable internal reality created by the trauma.
And if we just treat the symptom, the weight, the drinking, the behavior as the problem.
We miss the underlying wound and risk making things worse by removing the coping strategy without addressing the need it was meeting.
It reinforces that need to see the whole person, the ecology of their lives, not just a checklist of symptoms.
It demands empathy, a shift from judging behavior to understanding its origins in survival.
And this whole understanding how trauma lodges in the body, rewires the brain, shapes development, it demanded new ways of thinking about healing, moving beyond just talk or just medication.
Definitely. The limits of traditional talk therapy become obvious when you grasp the neurobiology. If someone's numb and dissociated or triggered into a flashback,
Their thinking brain is offline. They literally can't process the information verbally in that state. Talking about it might even re-traumatize them.
and we talked about desensitization. It might make you less reactive, but doesn't necessarily restore your capacity for joy or connection in the present.
And drugs.
They can provide crucial relief, maybe make overwhelming emotions more manageable, like with SSRIs, but they often suppress symptoms rather than resolving the underlying dysregulation. The source acknowledges their role, but cautions against seeing them as the whole answer, especially the risks in children.
So the shift is towards approaches that actively engage the body and the emotional brain. Befriending the emotional brain.
Recognizing we have innate tools. That statistic is amazing. 80% of the signals in the vagus nerve travel from the body up to the brain.
Meaning we can influence our brain state by working with our body.
Through things like breathing, movement, chanting, rhythm. Practices like yoga, which the source highlights as being incredibly effective, even for people resistant to other treatments.
Body awareness, mindfulness, becomes foundational.
Learning to notice physical sensations without judgment. Okay, there's tightness in my chest. Noticing how it shifts with the breath or movement or just allowing it to be there. It helps calm the nervous system, dial down the fight or flight.
Being able to tolerate those physical sensations is key before you can safely revisit difficult memories. Annie's yoga story is a great example.
Yeah, learning to breathe into discomfort, stay present, see her body as holding information, not just pain. That allowed her to finally trust her own experience.
And then there's the importance of safe connection, attuned interaction, Porges's work.
The social engagement system. To feel safe enough to connect, play, be nurtured, our defensive systems need to quiet down. Trauma makes that incredibly hard.
So sometimes simple, rhythmic, shared activities can be more helpful than talking.
The source suggests so. Moving together in sync, tapping out a rhythm. Our nervous systems pick up on these cues of safety, a calm voice, gentle movement much faster than our conscious minds. It bypasses the defenses.
The book then explores therapies that work directly with the fragmentation caused by trauma, like internal family systems, IFS.
IFS sees the mind as having different parts, like members of a family. Trauma can cause these parts to become extreme and polarized. A harsh inner critic, a frightened child part, a part that numbs everything out. These parts carry the burdens of the trauma.
And the goal of IFS
is to access the self, that core of wisdom, calm, compassion, that IFS believes is inherent in everyone, undamaged by trauma. It's not about getting rid of parts, but understanding their protective intentions, even if their methods are harmful now, and building trust so the self can lead.
You connect with the self by noticing how you feel towards a part.
Exactly. Peter's example. Realizing his critical part was actually trying to protect him from getting hurt again. Thanking it allowed it to relax. Then you can start to heal the deeply wounded, exiled parts they were protecting.
Psychomotor therapy, Bessel, is another embodied approach mentioned.
Using role players to create external structures or tableaus of your inner world or past relationships. Creating ideal figures you needed.
It's not just talking about it, but physically enacting it, feeling it differently in the present.
Right. Re-experiencing feeling safely, saying the unsaid, seeing the unseen. The source says it's like rewriting key scenes in the movie of your life. Maria feeling the relief when an ideal mother stood up for her. Mark confronting his father. It allows for a deep, corrective experience.
Theater programs also tap into this power of enactment and community.
Mixed transformation. The veterans working with playwrights. The source suggests ancient Greek drama might have served a similar function for collective trauma.
These programs build community, teach cause and effect through storytelling, give a sense of agency,
and allow people to explore intense emotions safely within a role, like Larry the veteran finding release playing Brutus. It's about processing personal experience through shared creation.
And finally, neurofeedback, using technology to retrain the brain directly.
Brain imaging shows trauma often leads to overactivity in fear centers, like the right temporal lobe, and underactivity in regulatory centers, like the frontal lobes. Neurofeedback gives real-time feedback on brainwave patterns,
helping the brain learn to calm the fear centers and strengthen executive function.
Lisa's testimony is incredibly compelling. Feeling calmer, stopping dissociation, being able to use her feelings instead of being overwhelmed, feeling less anxious, blood pressure dropping, being able to have a relationship, feeling free to actually live.
That ability to reflect, to have choice over feelings, not be trapped, that's huge.
It's about restoring balance and regulation at the most fundamental level.
So bringing all these pieces together, the history, the biology, the lived experience, the diagnostic challenges, these innovative healing approaches, what's the core takeaway?
I think it boils down to this. Healing trauma is more than just processing memories. It's fundamentally about addressing that deep inner void, the legacy of not being seen, validated, allowed to be yourself. It's about rebuilding a sense of agency and self-worth that was often disrupted very early on.
And it always comes back to the need for safety, especially safe relationships and community.
Feeling safe with others is maybe the bedrock of mental health. Healing happens in connection, where there's that reciprocity, being heard, seen, understood, and doing the same for others.
This has really practical applications too, like in schools.
Moving beyond just punishing disruptive behavior, which often stems from trauma, and instead training the whole school community to understand trauma's effects. Creating predictable, safe environments where kids feel known.
So instead of punishment, it's about acknowledging the distress, helping the child regulate, figuring out the trigger, finding solutions together.
Exactly. Consistency and predictability are vital for kids from chaotic homes. Even something simple like calling parents might be harmful if it leads to more abuse or blame at home.
It's clear that finding these answers required looking way beyond traditional psychiatry.
The author credits so many different pioneers. Body workers, therapists using IFS or PESO, theater artists, yoga teachers. It really underscores that healing often requires integrating wisdom from many different fields.
And the book's dedication is to the patients.
Calling them the true teachers, affirming that powerful life force that drives people to heal and create meaning despite immense suffering. It's incredibly hopeful.
So as we wrap up this deep dive into Chapter 4, what does this all mean for you listening right now?
Well, perhaps it gives you a different lens, a way to see your own reactions or the struggles of people you know, not as failures or flaws, but as complex embodied responses to overwhelming experiences, responses rooted in biology and survival.
It really emphasizes that healing often needs to involve the body, safe relationships, creativity, and befriending our internal world. It's not always just about talking or medication alone.
Those questions. Why is it so hard to relax? Why the intense triggers? Why the numbness or difficulty feeling present? This chapter offers some deep, science-backed answers based on the sources you brought us.
And it leaves us contemplating that powerful reframing. What looks like a problem today, the anxiety, the avoidance, the addiction, likely started as a necessary solution, a way to cope with the unbearable.
Understanding that history, that function, is often the very first step towards finding new, healthier ways to feel safe and truly alive in the present.
Before we sign off, just one last gentle reminder. If this conversation sparked something for you, hitting that like button or subscribing really does help us reach more people who might benefit.
And maybe a final thought to carry with you. How might your own body be keeping score of your life experiences? And what might happen if you started listening to its signals with a bit more curiosity and compassion, opening up possibilities for feeling more fully present?